You're taking metformin, aren't you? Every single day, you swallow that little pill, trusting it to be your silent guardian against the rising tide of blood sugar. It's a lifesaver, a cornerstone in managing type 2 diabetes, preventing those dreaded complications. And for good reason it is. But let me ask you something deeply personal. Have you ever found yourself sitting there, even with your blood sugar numbers looking relatively stable, feeling absolutely, utterly drained? A pervasive, bone-deep tiredness that no amount of sleep seems to fix? Perhaps you walk into a room and forget why you're there, or struggle to focus on a conversation, your mind feeling thick and cloudy, like a perpetual brain fog. Maybe it's that persistent tingling or numbness in your hands and feet, or even sharp, shooting pains that just don't seem to go away. And you think to yourself, well, I guess this is just part of having diabetes. Or it's just my age. You accept it because what else can you do? But what if I told you that there's a hidden cost to metformin, a silent thief operating beneath the surface, subtly, slowly, depleting your body of vital nutrients? And what if I told you that these very deficiencies are the real culprits behind that debilitating fatigue, that frustrating brain fog, those nerve issues, and even your struggling mood? The truth is, metformin, while incredibly effective, can significantly impact your body's ability to absorb and utilize certain essential vitamins and minerals. And it's this unseen depletion that often leaves you feeling far from your best, even when your blood sugar is under control. In this video, I'm going to pull back the curtain and reveal the top 3 crucial micronutrients that metformin can silently steal from you. You'll learn how to recognize the often overlooked signs of these deficiencies, and most importantly, I'll equip you with simple, actionable strategies through diet and targeted supplementation to replenish what's lost, reclaim your energy, sharpen your mind, and dramatically improve your quality of life, all while staying on your metformin. This isn't just about managing diabetes, it's about thriving with it. So, if you're ready to finally feel like yourself again, keep watching. Metformin, the savior and the silent thief. Let's start by acknowledging the incredible benefits of metformin. It truly is a pharmaceutical marvel for millions worldwide struggling with type 2 diabetes. Its primary job is to reduce the amount of glucose your liver produces and to increase your body's sensitivity to insulin, making it more effective at managing blood sugar levels. This not only helps control your current condition but also plays a critical role in preventing or delaying the onset of serious complications like heart disease, kidney damage, and nerve issues. For many, it's the first line of defense, a reliable partner in the daily battle against diabetes. But here's the crucial point. While metformin works diligently to bring down your blood sugar, its mechanism of action isn't without collateral effects. Like a double-edged sword, behind its remarkable benefits lies a lesser-known risk, one that far too few people are talking about. It's the risk of nutrient depletion. How does this happen? Well, metformin isn't directly designed to deplete nutrients, but rather, its influence on certain metabolic pathways and the digestive system can indirectly hinder your body's ability to absorb or retain specific vitamins and minerals. For instance, metformin can alter the function of specific transport proteins in your gut that are essential for the uptake of particular B vitamins. It might also influence gut flora, further complicating nutrient absorption. Think of it like this. While it's busy doing its primary job, some vital building blocks that your body needs to function optimally are getting lost or aren't being picked up efficiently along the way. Multiple scientific studies have consistently shown that long-term use of metformin can significantly reduce the levels of certain B vitamins, particularly vitamin B12, and can also impact the levels of folate, B9, and thiamine, B1. In some cases, B12 levels have been observed to drop by as much as 30% or more after several years of metformin use. This isn't a rare side effect. It's a common, clinically recognized consequence. And these aren't just any vitamins. They are foundational to your energy, your nerve health, your mental clarity, and so much more. Ignoring these deficiencies isn't just about feeling a bit off. It can genuinely exacerbate diabetes complications and drastically diminish your quality of life. Now, let's dive deep into these 3 critical nutrients and discover how you can take back control. 3 essential nutrients metformin often steals and their solutions. Let's break down the 3 most common and impactful nutrient deficiencies associated with metformin use, focusing on why they matter, how to spot the signs, and what you can do to replenish them. 1. Vitamin B12 cobalamin. Importance: vitamin B12 is often called the energy vitamin, and for good reason, but its roles extend far beyond just keeping you awake. It's absolutely crucial for the proper functioning and development of your brain and nerve cells. Think of it as the insulation around your nerve wires. Without enough B12, these wires can fray, leading to misfires and damage. It's also vital for DNA synthesis, the very blueprint of every cell in your body, and for the formation of healthy red blood cells that carry oxygen throughout your system. For individuals with diabetes, robust nerve function and healthy blood flow are paramount, making B12 even more critical. Why metformin depletes it? Metformin's primary mechanism for causing B12 deficiency involves interfering with the absorption of B12 in the ileum, which is the last part of your small intestine. Specifically, it can reduce the activity of a protein called intrinsic factor, which is necessary for B12 absorption. Imagine the intrinsic factor as a key that unlocks the door for B12 to enter your bloodstream. Metformin can essentially jam that lock, making it harder for B12 to get in, even if you're consuming enough of it. This isn't about not eating enough B12, it's about your body not being able to use what you're eating effectively. Check yourself, are you experiencing these signs? If you're on metformin, pay close attention to these common, yet often dismissed, symptoms. Typical deficiency signs. Chronic fatigue and weakness. This isn't just feeling tired after a long day. This is a profound, persistent exhaustion that sleep doesn't fix, often accompanied by general weakness. You might feel like you're moving through quicksand. Peripheral neuropathy, tingling/numbness. This is one of the most classic signs. You might experience pins and needles, numbness, burning, or a strange, crawling sensation in your hands, feet, or legs. While these can be symptoms of diabetic neuropathy, B12 deficiency can mimic or even worsen these sensations, making it difficult to differentiate the cause without testing. Cognitive issues, brain fog, memory loss, difficulty concentrating, problems with memory, especially short-term, feeling mentally sluggish, or just a general sense of brain fog where thoughts feel hazy. This can severely impact your daily life and productivity. Mood changes, irritability, depression, or increased anxiety. B12 plays a role in neurotransmitter production, so its deficiency can impact your emotional well-being. Pale skin and shortness of breath. Due to its role in red blood cell formation, severe B12 deficiency can lead to anemia, causing pallor and a feeling of breathlessness, even with minimal exertion. Sore, red tongue glossitis, a less common but distinct symptom where your tongue might feel smooth, inflamed, and painful. Here's the critical link: if you are taking metformin and are experiencing tingling, numbness, or any form of nerve pain, do not immediately assume it's solely diabetic neuropathy. It could very well be a cry for help from your nervous system screaming for B12. Impact on diabetes. Undiagnosed or untreated B12 deficiency in metformin users can exacerbate or mimic diabetic neuropathy, leading to unnecessary suffering and potentially delayed diagnosis of the true underlying issue. It can also impair overall cellular function, indirectly making blood sugar management harder. Solutions. Food sources. B12 is predominantly found in animal products. Excellent sources include grass-fed beef, liver, especially beef liver, a B12 powerhouse, salmon, tuna, clams, eggs, and dairy products, milk, cheese. For vegetarians/vegans, fortified foods, cereals, plant-based milks, and nutritional yeast are options, but often insufficient for those on metformin. Supplementation. Crucial reminder, always consult your doctor or a qualified healthcare professional before starting any new supplement, especially if you are on medication. They can help determine the right dose and form for you. Preferred forms. Opt for biologically active forms like methylcobalamin or adenosylcobalamin over cyanocobalamin. Cyanocobalamin is a synthetic form that your body needs to convert, and some people may have difficulty with this conversion. Recommended dosage. Often, dosages range from 500 micrograms to 1,000 micrograms per day or as directed by your doctor, especially if blood tests confirm a deficiency. Sublingual, under the tongue, forms or even B12 injections may be recommended for better absorption, bypassing the compromised gut pathway. 2. Vitamin B9 folate. Importance. Folate, often confused with its synthetic counterpart, folic acid, is another cornerstone B vitamin. It's indispensable for DNA synthesis and repair, meaning every single cell in your body relies on it to replicate correctly. This makes it vital for rapidly dividing cells, like those in your red blood marrow or gut lining. Beyond cellular health, folate is essential for red blood cell formation, and critically, it works hand in hand with B12 in regulating homocysteine levels. Elevated homocysteine is a well-established risk factor for heart disease and stroke, issues that are already a heightened concern for individuals with diabetes. Furthermore, adequate folate levels have been linked to better insulin sensitivity, playing a subtle but important role in overall metabolic health. Why metformin depletes it? While the direct mechanism isn't as clearly defined as with B12, metformin has been shown in some studies to indirectly affect folate metabolism or absorption. One theory suggests it might interfere with the absorption process in the small intestine, similar to B12, or affect enzymes involved in folate pathways. The B vitamins often work in synergy, so a disruption in one can cascade and impact others. Did you know B9 deficiency can worsen insulin resistance and make blood sugar control harder? It's true. So let's look at the signs. Typical deficiency signs. Fatigue and weakness. Just like B12, inadequate folate can lead to megaloblastic anemia, where red blood cells are abnormally large and inefficient at carrying oxygen, resulting in profound tiredness. Brain fog and cognitive decline. Difficulty concentrating, memory problems, and general mental sluggishness can also be indicative of low folate. Mood disturbances, irritability, depression, and mood swings are common, as folate is involved in the synthesis of neurotransmitters like serotonin and dopamine. Mouth sores and swollen tongue. Similar to B12, oral symptoms like painful sores, ulcers on the tongue or in the mouth, or a swollen, smooth tongue can occur. Pale skin and shortness of breath. Due to anemia, your skin might appear pale and you might experience shortness of breath even with mild activity. The critical takeaway here: if you're diligently monitoring your blood sugar and sticking to your diet, yet still feel sluggish and your mood is constantly battling you, don't overlook the possibility of a folate deficiency potentially worsening your insulin sensitivity and making your diabetes management feel like an uphill battle. Impact on diabetes. As mentioned, folate plays a role in homocysteine metabolism. High homocysteine levels are a significant risk factor for cardiovascular disease, a common complication of diabetes. By depleting folate, metformin could indirectly contribute to this risk. Furthermore, its role in DNA synthesis and cellular health means that deficiency could impair the body's overall resilience and ability to heal, which is especially important for diabetics prone to complications. Solutions. Food sources. Folate is abundant in many plant-based foods, but remember, it's quite sensitive to heat and can be destroyed during cooking. So, raw or lightly cooked options are best. Rich sources include liver, asparagus, spinach, and other dark leafy greens like kale, romaine, avocado, lentils, chickpeas, broccoli, Brussels sprouts. Pro tip for optimal absorption: include these foods in your diet regularly, aiming for a variety, and try to consume some of them raw or lightly steamed to preserve their folate content. Supplementation. Crucial reminder: always consult your doctor or a qualified healthcare professional before starting any new supplement. Preferred form. Just like B12, the synthetic folic acid needs to be converted by the body into its active form. Many people have a genetic mutation, MTHFR, that impairs this conversion. Therefore, it's best to choose the active form, methylfolate, 5-MTHF, which is immediately usable by your body. Recommended dosage. Common dosages range from 400 micrograms to 800 micrograms per day, or as advised by your healthcare provider, especially if you have an MTHFR mutation or confirmed deficiency. 3. Vitamin B1, thiamine. Importance. Vitamin B1, or thiamine, is truly a silent hero for your energy and nervous system. Its primary role is to help your body convert carbohydrates, the sugars you consume, into usable energy. Without enough B1, your body struggles to generate ATP, the cellular currency of energy. This is particularly crucial for your brain and nervous system, which are high-energy consumers. Thiamine also plays a critical role in nerve function, protecting nerve cells from damage and supporting nerve signal transmission. For diabetics, who often have challenges with glucose metabolism, having robust thiamine levels is absolutely vital for managing energy and protecting against nerve complications. Why metformin depletes it? Research suggests that metformin can interfere with the absorption of thiamine from the gut and may also increase its excretion by the kidneys. This means that even if you're consuming enough thiamine, your body might not be absorbing it efficiently, or it might be flushing it out too quickly. This double whammy can lead to a significant depletion over time, directly impacting your energy production and nerve health. B1 is the silent hero of energy and nerves. Without it, your body will struggle to turn sugar into energy, leading to prolonged fatigue. And what does that look like in your daily life? Typical deficiency signs: persistent fatigue and low energy. This is a hallmark symptom. Because your body can't efficiently convert carbs to energy, you'll feel drained, sluggish, and constantly tired, no matter how much you rest. Brain fog and cognitive impairment. Difficulty concentrating, memory loss, irritability, and general mental fuzziness are common. Your brain needs a constant supply of energy, and without B1, its function declines. Peripheral neuropathy, tingling/burning. This is a critical one for diabetics. B1 deficiency can cause or worsen symptoms very similar to diabetic neuropathy, including numbness, tingling, burning sensations, or even pain in the hands and feet. This is due to damage to the peripheral nerves. Gastrointestinal issues. Loss of appetite, nausea, and abdominal discomfort can occur. Cardiovascular symptoms. In severe cases, thiamine deficiency, beriberi, can lead to rapid heart rate, shortness of breath, and fluid retention as the heart struggles to pump efficiently. Mood changes. Irritability, anxiety, and even depression can manifest. The profound connection. If you are struggling with nerve pain, burning sensations, or that unrelenting heavy fatigue while on metformin, B1 deficiency should be high on your list of potential causes. It's often mistaken for diabetic neuropathy because the symptoms are so strikingly similar. Impact on diabetes. Thiamine deficiency can directly impair glucose metabolism, potentially making blood sugar control more challenging. More significantly, it can contribute to or worsen diabetic neuropathy, retinopathy, eye damage, and nephropathy, kidney damage, as these complications are often linked to poor glucose utilization and oxidative stress, both of which thiamine helps to counteract. Solutions. Food sources. Thiamine is found in a variety of foods, though cooking can reduce its content. Good sources include pork, especially pork tenderloin, sunflower seeds, whole grains, oats, brown rice, barley, legumes, black beans, lentils, salmon, liver, nutritional yeast. Tip: opt for whole, unprocessed foods. Be mindful that alcohol and excessive consumption of refined carbohydrates can increase your thiamine needs or deplete stores. Supplementation. Crucial reminder: always consult your doctor or a qualified healthcare professional before starting any new supplement. Preferred forms. Unlike water-soluble thiamine HCl, which is poorly absorbed, especially in those with gut issues, lipid-soluble forms like benfotiamine or lithiamine are much more bioavailable and effective at raising thiamine levels, particularly for neurological symptoms. Recommended dosage. For general support, doses might range from 50-100 mg/day. For managing or preventing diabetic neuropathy, higher doses of benfotiamine, often 150 to 300 milligrams per day, are frequently recommended, but this should always be under medical supervision. Critical action steps. Now that you understand the crucial connection between metformin and these vital nutrients, it's time to talk about action. This isn't just about knowledge, it's about empowerment and taking proactive steps towards better health. 1. Don't self-diagnose, communicate with your doctor. Let me be crystal clear, this video provides general health information and is not a substitute for professional medical advice. The most important step you can take is to have an open, frank conversation with your healthcare provider. Share what you've learned here, express your concerns, and discuss your symptoms. Your doctor is your primary partner in managing your diabetes and overall health. 2. Request specific lab tests. Many standard blood tests might only give a superficial look at nutrient levels. To get a clear picture, you might need to ask for more specific tests. For vitamin B12, request not just serum B12 levels, but also methylmalonic acid, MMA, and homocysteine levels. MMA and homocysteine are more sensitive indicators of functional B12 deficiency at the cellular level, even if your serum B12 appears normal. For folate, ask for RBC folate, red blood cell folate, which provides a better long-term indicator of your folate status within the cells rather than just what's circulating in your blood. For thiamine, while less commonly available, whole blood thiamine or erythrocyte transcatolase activity can be more accurate than serum thiamine, as most thiamine is inside cells. Your doctor can guide you on the most appropriate test. 3. Optimize your lifestyle and nutrition. Supplements are powerful tools, but they work best when integrated into a foundation of good nutrition. Prioritize whole, nutrient-dense foods. Focus on incorporating the rich food sources of B12, B9, and B1 into your daily meals. Think colorful vegetables, lean proteins, healthy fats, and minimally processed foods. A diet rich in whole foods naturally provides a broader spectrum of nutrients and supports overall gut health, which aids absorption. Mindful cooking. For folate and thiamine, which are sensitive to heat, try to include some raw or lightly cooked options like fresh salads, steamed vegetables, and whole fruits. Hydration and sleep. Don't underestimate the power of adequate hydration and quality sleep in supporting your body's recovery and metabolic processes. 4. Discuss targeted supplementation with your doctor. If tests confirm a deficiency, or if your symptoms strongly suggest one, discuss the appropriate form and dosage of supplements. Remember the importance of specific forms: methylcobalamin/adenosylcobalamin for B12, methylfolate, 5-MTHF, 4B9, and benfotiamine/lithiamine for B1. These active forms are typically better absorbed and utilized, especially when absorption pathways might be compromised by metformin. Your doctor, or a registered dietitian or nutritionist specializing in functional medicine, can help you craft a personalized supplementation plan that is safe and effective alongside your metformin. They can also advise on potential interactions with other medications you might be taking. By proactively addressing these potential deficiencies, you're not just chasing symptoms, you're tackling an underlying cause that could be significantly impacting your energy, your clarity, and your overall well-being. We've covered a lot today, and I hope it has brought a new level of awareness and understanding to your health journey. Here's the core message I want you to walk away with. Metformin is an invaluable medication that has transformed diabetes management for millions. But like any powerful tool, it comes with a hidden side: the potential to deplete your body of essential vitamins B12, B9, and B1. The profound fatigue, the frustrating brain fog, the nerve tingling, and even mood disturbances you might be experiencing might not just be part of diabetes or getting older. They could very well be silent signals that your body is missing these critical micronutrients. The good news, the truly empowering news, is that once you understand this connection, you are no longer a passive recipient of these symptoms. You have the knowledge and the actionable steps to reclaim your vitality. By working closely with your healthcare team, getting the right tests, optimizing your diet, and strategically supplementing with the correct forms of these vitamins, you can dramatically improve your energy levels, sharpen your focus, alleviate nerve issues, and genuinely enhance your quality of life. You absolutely deserve to live a vibrant, energetic life, even while managing diabetes and taking metformin. Don't accept debilitating symptoms as your inevitable fate. Be proactive, be informed, be your own best health advocate. If this video has shed light on your own experiences, or if you know someone on metformin who might benefit from this crucial information, please don't keep it to yourself. Give this video a like to help it reach more people. Share it with friends, family, or anyone in your community who uses metformin. Subscribe to our channel right now and hit that notification bell so you don't miss out on our upcoming videos packed with more practical, empowering health insights. And most importantly, I want to hear from you. Leave a comment below sharing your experiences, your questions, or any insights you've gained from this video. Your journey and your questions can help countless others. For a detailed list of food sources, preferred supplement forms, and additional resources mentioned in this video, check out the description box below. Thank you for investing in your health today. Together, we can transform how we approach chronic conditions and truly thrive. See you in the next video.